Hello, Madam Chair, Mr. Chairman, Mr. Vice Chair. Thank you so much for the opportunity to speak to you today. I want to echo John's comments, of course, but I wanted to start by thanking both of you, especially the Joint Committee on Ways and Means, for your communication and your efforts over the past few months to talk, particularly obviously with the employer community, but with all stakeholders. Mr. Chairman, I want to highlight your comment earlier today where you pointed to the diversity in the room, to the individuals and groups who are in the room, and I do want to emphasize that I think in Massachusetts, particularly with healthcare and health insurance, that is our strength. Where a diversity of opinions and perspectives might gridlock DC, we have demonstrated that that brings us together and produces a higher quality, we think a higher quality of policy, and it's another opportunity this year to do that, so I do want to thank both of you very much. And I think that also further highlights John's comments that we were publicly supportive, obviously, of the governor's package, his proposal before us, because although, yes, it does levy an increase in taxes on the employer community, it balances that with some longer-term reforms. And obviously, although we recognize there are short-term obstacles that we need to overcome, we are also concerned as an employer community about the long-term effects in Massachusetts and the healthcare system. And there's no question that although we are representing the commercial healthcare industry, there are connections and interactions with the public healthcare market that are always going to continue and always going to add to the complexity of this wonderful program. But those are keeping my comments simple so I don't run up against the buzzer. Just wanted to thank you both very much for the opportunity to speak to you today. Mr. Chairman, I just wanted to respond a little bit to sort of why the employer community might be supportive of these ideas, and I do think sort of goes back to my comment before about how we were all able to work together in 2006 to create universal health care policy in Massachusetts. And I think a number of these policies, particularly in the federal waiver, would return us to policies that are very familiar to the employer community, whether that's the employer gate, which they were all very familiar with, the HERD form, obviously that's not in the waiver, but all of these sort of policies these are things we're all familiar with. These are things that we created in Massachusetts, they're unique to us, and they made sense to the employer community. And with the implementation of the Affordable Care Act, so much of that changed and seemed to change every 6 months when the federal government decided, okay, no, we're not going to implement that now, we're going to wait 6 months to implement that policy, but we'll implement this part. Whether it's the incredibly confusing forms that we've talked about before that employers need to fill out. We contrast that with our HERD form. Even if we do a new HERD form with additional information, it's still much more straightforward and familiar to the employer community than the requirements from the federal level. So all of these different policies, the idea, yes, there might be a lot of uncertainty on the federal level, but I think the openness in the employer community is there to really return to what we decided in Massachusetts worked for us. And we decided that as a pretty diverse group coming together. So I think that's really what it comes down to is we've experienced such uncertainty over the past 3 years, perhaps, of policies changing. And